Did you know that your heart can be operated on while it's still beating? Today, we're diving into another advancement in heart surgery right here at Asiri Central Hospital. What is off-pump CABG and how does it work?
So, before explaining about off-pump surgery, I would rather start with so-called on-pump surgery or the traditional way of doing bypass surgery. The traditional way of doing bypass surgery is you put the patient on a so-called heart-lung machine, which will take over the function of the heart and the lung. And then we stop the heart and do the bypass grafts. So compared to this on-pump surgery, off-pump surgery involves doing this same operation without any affecting the quality of the surgery. We avoid using the heart-lung machine. So basically the surgery will be done while the heart is functioning normally, beating.
Does it make the procedure easy on the body?
Of course, during the so-called on-pump surgery, your blood will be going through a machine, so-called heart-lung machine. It evokes a response from the body, what we call the inflammatory response. Well, the inflammatory response, sometimes it can go in a more or less a overdrive, which can be really harmful. There is some degree of damage to the lungs, kidneys, and heart muscle also. But most of the time in off-pump surgery, it's negligible. But there are some other changes which may not be seen, especially kidney function. There may be some mild degree of kidney impairment. It can affect the brain also. There are some things which won't be evident as such, but there is some deleterious effects on the body when we use the heart-lung machine. Off-pump surgery tries to avoid these problems with heart-lung machine causing a reaction on the body.
Who might need this kind of surgery?
Well, off-pump surgery is applicable to any group of patients. But there are certain groups of patients who will benefit more compared to other groups. Well, basically elderly patients, patients with kidney or liver impairment, patients with respiratory disease, and patients with poor heart functions. These are the groups which usually have a better outcome compared to on-pump surgery. But certainly, any type of patients, any group of patients will be suitable for this type of surgery.
Is this a common procedure at Asiri Central Hospital?
Of course, off-pump surgery is the commonest procedure we do at Asiri Central. Basically, when we talk of adult cardiac surgery, bypass surgery is the majority. And we do most of our bypass surgeries in this manner, or so-called off-pump manner. Nearly 80 to 85% of our patients who undergo bypass surgery will be subjected to off-pump surgery.
We now offer a special CABG package for both off-pump procedures and on-pump, designed to give you the best care at a comprehensive rate with expertise you can trust.